Many people notice their vision gets worse as they age, but millions of older adults will find their central vision will diminish so greatly they can't see what's right in front of them. It can make the most simple things difficult. Here to talk about maintaining independence and quality of life, Dr. Marc Levy. Good morning, doctor.
Good morning.
I know this impacts so many families out there, but give us a few ways that loved ones can support older adults suffering from vision loss.
Well, if you have a family member that has visual loss, the first thing you want to do is make sure that they have seen their eye physician. They've gone to see the eye doctor, the doctor has performed a dilated examination and finds out what's the cause of their vision. If it's due to macular degeneration, there's some exciting new breakthroughs that we can offer patients with macular degeneration in the treatment of their visual loss.
Yeah, I want to stop you right there. Macular degeneration, what is that? Especially age-related.
Age-related macular degeneration is a condition, it's actually a condition that is the most common cause of visual loss and legal blindness in Americans over the age of 60. It's a condition where the center part of our vision, the macula, which is part of the retina or film of the camera, degenerates or atrophies. It causes a central blind spot in front of our vision that follows us everywhere we go. Up to most recently, we had no treatment for the more common dry form. The wet form is the form where blood vessels grow underneath the retina, bleed, and block our vision. We could treat that with injections and laser. But in the dry form, we previously, until most recently, had no treatment for these patients. Now patients over the age of 65 can have a telescopic device placed into their eye, a telescope implant, to improve their vision. Science fiction becoming science fact in 2015.
This is amazing. How does it help their vision? How effective is that treatment option?
Well, imagine if you were looking through a set of binoculars in one eye. It magnifies the vision. It actually magnifies the image in front of their eye so the blind spot doesn't bother them anymore. If you remember Steve Austin, the $6 million man,
yeah.
He had a telescope placed inside his eye. Well, that's something we now can do in order to treat patients afflicted with macular degeneration.
Incredible technology that we're talking about here. Where can our viewers learn more online?
They can go online to CentraSight, SIGHT.com. That's sight like in vision, not S-I-T-E like in website.
Right.
CentraSight.com, and they can learn about the telescopic implant that goes inside the eye.
Are there certain patients that are more qualified for that implant than others?
Yes, well, first of all, the patients cannot have had previous cataract surgery. Their eye has to be healthy, and they have to be over the age of 65, and they have to go see their eye physician to make sure that this is an appropriate type of surgery for them.
And the outcome, is there a percentage of how effective it is on those patients to get the implant?
We actually did an FDA trial between 2002 and 2004, and most patients improved vision 3 lines. Several of my patients back in 2002 and 2004 improved vision 5 lines. That's amazing.
Wow.
With macular degeneration.
Yeah, an incredible outcome. Again, to visit the website online, what was that again, just to remind our viewers?
Sure, the website is CentraSight, SIGHT.com, or they can actually simply call the phone number 877-99-SIGHT, S-I-G-H-T.
Doctor, fascinating stuff this morning. Thanks for your time. We appreciate it. And Mutual Omaha's Wild Kingdom Wild Guide, Stephanie Arney, joined us yesterday. She brought a number of creatures with her, some of them scary, some of them with no legs, Nikki. And you can see the exotic animal found wandering around Cunningham Lake by watching that video at OmahaMorningBlend.com. Supplements, they've made a number of headlines lately, some big name stores pulling certain brands.
As consumers, are we right to be concerned?
Yeah, Mary and I had a chance to visit with health correspondent Jim Morelli when he passed through town yesterday. We're going to share that interview when the Morning Blend continues.